Thank you. Yesterday I shared Melody and Vernon Harper's story with the House. Vernon is with us in the gallery today. Their story is all too common for Indigenous Manitobans. I stand here today willing and wanting to work with this government to find solutions to the many issues Indigenous people face when navigating Manitoba's healthcare system. Melody's health continues to worsen, but because she had such an incredible support system of people working with the doctors and nurses today, her care has greatly improved. Will the minister consider instituting an Indigenous Health Advocate within Manitoba Health?
The Honourable Minister of Sustainable Development.
Well, first of all, I want to express my sympathies and heartfelt passion for the family. And I know yesterday the Minister had asked for information from the MLA, and I certainly hope that that information was delivered so our government can act on this.
Exactly.
The Honourable Member for Kewatinook on a supplementary question.
Thank you. Many doctors who have been involved in Melody's care these past 2 years have wrongfully and disrespectfully labeled her as an addict. Both her and her husband have not only had to endure these medical mistakes of nicked organs during surgeries, but they have also had to endure the added stress of medical staff accusing of Melody of looking for a high. I can't imagine how that stress has complicated her journey to well-being. If the doctors truly believed that statement, then why was there never a referral to an addiction specialist? What is this government doing to change the perception of healthcare staff for Indigenous Manitobans who are only trying to access medical care?
The Honourable Minister of Sustainable Development.
Thank you very much, Madam Speaker. Our government wants to work with all MLAs in this chamber and all Manitobans in improving our healthcare system.
Right.
And I certainly do hope, and I extend an invitation, a welcome to the MLA to work cooperatively with us instead of casting aspersions.
Mm-hmm. Right.
The Honourable Member for Kewatinook on a final supplementary.
What this young mother has had to endure over the last 2 years is complete agony. And that agony has far-reaching effects on her husband and other family members. We have a real opportunity here to change the course of how Indigenous people are being mistreated in Manitoba's healthcare system. There is strength in numbers. As shocking and disturbing as Melody's story is, it is a story that this government can learn from. So I ask again, will the Minister of Health call for an inquiry into Melody Harper's situation today so that my people don't have to face another post-mortem Brian Sinclair inquiry?
The Honourable Minister of Sustainable Development.
Thank you very much. The opportunity for improvement exists in collaboration, and I will ask the member once again to share the information with us and to work with us on proving better outcomes.